लॉजिकल एंड में आना है.
So hello everybody, greetings from Hcfi Foundation of India Roundtable. I'm Dr. K.K. Agarwal. Welcome to our non-stop 47th Roundtable meeting. For me it is 1792nd meeting. So over to Dr. Kalra to introduce the subject.
Thank you, sir. I welcome all the roundtable experts on this 47th roundtable expert meeting. Today's topic is immunity passport. This is not a new concept. We know even international vaccination certificate or passports for yellow fever and other vaccinations already exist. And people who are traveling globally, they require to have some form of a documentation, and these certificates for vaccinations, they are immunity passports. Same way in respect of COVID-19. Now with the availability of vaccines, and almost a year now has passed since we are facing the challenge of COVID-19, and now people are restarting, they are returning to work, they have started travel, domestic as well as international travel, and every routine activities for social and economic reasons is now increasing. But the risk of transmission is still very high. Although in few countries the trend has shown a decline, but even in India, more than 7 states again has shown now little slight surge in number of cases. Now with the availability of vaccines, again probably a certificate, a documentation of something which ensure that person is safe, he is protected, and he is not posing any risk to others. So that documentation in the form of a vaccination certificate or some kind of evidence in the form of a reports that he has recovered, he has developed antibodies, especially the neutralizing antibodies, and he is safe for others as well as for himself for any chances of reinfection. So today we'll be discussing, but there are certain challenges also, because in respect of COVID-19, still we do not know many things, whether these vaccines, which are the first generation vaccines we are now getting, they are fully protected, is neutralizing antibodies are developing in every person who is vaccinated, or other things, even negative PCR report, RT-PCR, again, there are certain challenges. So to discuss those regarding vaccinations and immunity passport or the certificate, now we will be discussing today. With these remarks, I hand over to Dr. Agarwal further start the session. And I request Dr. Sunila to chair this session, or you are to go a little early.
Yeah, I'll be going, and there's a meeting simultaneously going on elderly care. So I'll be going because that started. I told them I'll come after, around 11:30 for
Like
that.
Dr. D.R. Rai chair this meeting today.
Thank you, Dr. Gawa. Thank you, Dr.
So, the subject today is very simple. We are not going to discuss the fallacies of the test or the inadequacies of the test, because the concept of immunity passport cannot be validated at all.
Yeah.
So we will be discussing the concept of immunity passport and harm reduction. So we will very clearly say we are reducing the load and harm reduction and not eradicating possibility of an infection. So with that, I will show you some slides.
Dr. Agarwal, only my first comment is that last time when I spoke about harm reduction, they said, Madam, harm reduction we are using only in two specific contexts. That is in context of alcohol and tobacco particularly. So that's where they said you can have the risk reduction or whatever.
Risk
So,
reduction. Okay.
Yeah. Okay. So that
So
way.
we use the word risk reduction.
Yeah. Thank you so much. Thank you.
That's very good. Mm. So when we come back to COVID passport, so I'll put down as a risk reduction. That's a better terminology. So this is in terms of Delhi's news which came today, that Delhi has made it mandatory for people traveling from 5 states to get a negative COVID-19 report before entering. Okay. I hope negative COVID-19 report includes any test. But the next line say people traveling to Delhi from Maharashtra, Kerala, Chhattisgarh, Madhya Pradesh, and Punjab must furnish a negative RT-PCR test report. I hope this is a mistake of the reporter who has reported it, because it has to be a negative COVID-19 report, which must include a RT-PCR or a antigen test. The order is applicable to passengers who will be arriving in Delhi by flights, train, or buses. I hope they mean also auto, taxi, cars, on foot, because when you have such an order, it would mean anybody entering trucks, because otherwise this will be a mode of corruption. A truck will come that in the order it is not written. So therefore give me 2,000 rupees and you go. The COVID-19 negative report should be not older than 72 hours. Now, therefore, whatever is the, when you are doing such type of a request, it is missing antigen, and it is also missing the documentation of recovery. It is also missing the documentation of vaccination. So this Delhi order, I have not seen the order, which is there in the report. Most likely the reporter has not been able to understand. By all means, the order would mean that you are a non-infectious. So when you talk about a passport, when you talk about a passport, when you talk about passport, take the S out. When you talk about a passport, you can have a passport by having a document called I am RT-PCR test negative or antigen test negative. 2 tests not required. Or you have a certificate with you that I am antibody positive, which can be IgM antibody, IgG antibody, IgA nobody is doing, total antibodies, or you can have a certificate of IgG-S antibodies or IgG-N antibodies, or you have a certificate of neutralizing antibodies. Or you should have written in your that I'm vaccinated first dose, second dose, or both. So I'm vaccination or I'm second dose means obviously that both. Then you may have a vaccination of post-vaccination S antibodies. In case of COVID, it will be post-vaccination S or N antibodies, or you have a certificate of neutralizing antibodies, or you have with you a documentation of recovery based on CDC, WHO, Ministry of Health guidelines, where they say that 3 days after the symptoms or 10 days if I've recovered after the illness, you need not go for testing. Then some registered medical practitioner can give them a documentation of recovery that you have recovered and no more infectious. And the date can decide 3 months, 6 months validity. The government has not cleared. Documentation of recovery is valid for how long? 3 months or 6 months. Now, this is what the US guidelines are. And the US guidelines you read in the last line after CDC, if you fly to the US from a foreign country, you must provide a negative COVID-19 test. They don't talk about RT-PCR. A negative COVID-19 test or documentation of recovery. So very clearly, international, the most important thing is documentation of recovery. And they have given a formula of 3 days. That means 3 days before the travel and 3 days after the travel. So after your travel is over, and when you come back to your city, then you have 3 days before travel and 3 days after travel. And if you read this after the travel, again, this is 3 days after the travel and then take a decision. That's what the formula. Now, this formula is based on areas where the prevalence is high or the appropriate, there is a issue by the government, which is now, say, for example, these 4 states from where somebody comes, this will become valid for those people who are coming from these 4 states to Delhi, that after either they get them tested after 3 days or they isolate themselves for 10 days. Now, what is this concept of passport? The word passport is an international term, and they are talking about digitizing the passport word for the matter of international travel. The US, UK, and European Union are among those considering whether to introduce a digital passport that will allow citizens to show as they have been vaccinated against COVID-19. I've been told, I saw a circular yesterday that all European countries have mandated that you have to be vaccinated before you enter to their country. Remember the word they are using, vaccinated. That means now people, every country will have their own decisions, whether they will allow proof of cure, recovered, whether they will have antibody as a test. They have written vaccinated. They have written, because somebody came to me yesterday, I'm going to Europe. How will I get my vaccinated certificate? So some states are thinking that in some countries, people will not allow entry to public places unless you have carrying a certificate with you. So a vaccination passport, vaccination pass or a passport is a documentation proving that you have been vaccinated against COVID-19. So this term passport now is coming more for the vaccination. Some versions will also allow people to show that they have tested negative for the virus and therefore can more easily travel. And most of the airlines industry groups, they are working on the concept of digital passport. That means it makes you easier for people to travel before in other countries. Significant of time will be saved in airports if you have a passport. Now, IATA is talking about a service where throughout the world, your name will be entered and you will be having a barcode. Based on that barcode, you can pass on without showing any paper. So maybe a time to come, you may get, like all airlines will start registering you. It's like an Aadhaar card. May become like you have a barcode, you are vaccinated or not vaccinated. Why would I need a vaccine pass or a passport? The pass would generate a QR code that could be shown to authorities. In order to travel internationally, government and health authorities will need to know if you have been vaccinated or not. Many countries may ask you proof of a negative test for entry. Such pass could be essential to restarting the tourism industry. They also may eliminate the need for quarantine on an arrival, a policy which is also standing in the way of return of international tourism. People who say that this is not correct, The activist who says that they say this is giving false assurance to the people, and they are talking about it is discriminating the people because those people, this is a discrimination, this is a human right violation and discrimination. The president Biden very clearly said to assess the feasibility of a passport. The UK Prime Minister has ordered a review on vaccine passports. The European Council is now meeting on the concept of what should be an international policy on vaccine transport, vaccine. The WHO says, as on today, no. WHO says we don't support the concept of it should not introduce requirements of proof of vaccination or immunity for international travel as a condition for entry. So they says there are still critical unknowns regarding the efficacy of vaccination and reducing transmission and limited availability of vaccine. So that's what the situation as of today is. WHO says it should not be a must. US, UK is saying international travel will not be allowed. Most of the airlines now are offering vaccinations and antibody testing as a part of pre-booking. Some of them are giving you a free test. I have heard of a travel agent who says, book through us, we will arrange for your vaccination or antibody test and issue you a certificate. Purpose of bringing this question was, if you have a certificate with you, with a valid registered medical practitioner, valid certificate with you, that either you are non-infectious on the basis of proof of recovery, or you are virus antigen or the gene test negative, RT-PCR or antigen negative, or you have suffered an infection in the past based on total antibodies or IgG antibodies, or you have been vaccinated at least once. I'm talking about one vaccination because some people, second vaccination may not be given to them. If they have reaction on the first vaccination, they cannot be a criteria of not traveling. So the time has come from all of us to have, wherever we carry any place, we carry with that certificate. Now, if you don't do that, what will happen? Let me imagine certain situations. You are flying from Delhi to Chennai and you start coughing or sneezing. There will be a havoc in the flight. If you are in a mall, if you develop a allergic rhinitis, people may start bashing you in that particular area. If you go to an international flight, you get down, if you start coughing, that may be unrelated cough, you may be put into 17 days quarantine immediately. So therefore, all of us are requested, specifically people on ACE inhibitors, they have cough all the time. And if you are coughing, unless you have a certificate with you, so today's meeting is for discussing that it should be advisable as a guideline from the roundtable that everybody carries I'm not talking it as a passport, I'm calling it as a pass, I'm calling it as a certificate that you are non-infectious and you are not contagious to others. Somebody will be otherwise a violence can put up something like we saw violence coming to medical doctors with the PPE kit returning, people abusing them. So therefore, it is always better to say, hey, I am COVID negative. And that's for international travel, national travel. Over to Dr. Rai to invite suggestions from people.
Thank you, Dr. KK. Nicely you have elaborated, because it becomes mandatory and a responsibility of each and every person who wants to travel from one country to other country. And the norms laid down by the different countries has to be followed has to be observed also. And because of the whole world has suffered from this pandemic, and if we want to be safe in every country whichever we are visiting, first of all, one person himself should be a safe, vaccinated, or he has got a vaccination, or he has become immunity, he's having the immunity. So as far as the concept of this passport or pass is concerned, it is a good one. I remember when I traveled to the Brazil, the first thing which I was asked to them, until unless you are not having a yellow fever certificate, you will not be in position to board the flight. So these are the things one we should, and definitely now, now that as the second wave is at the door, people are scared. When in our own country, Delhi has introduced this restriction to the 6 states, those persons who are traveling, and they will have to show. But here I have got one query particularly. The persons who are coming by air can be monitored nicely. The person who are coming by train, it's very difficult to segregate. Are you coming from Maharashtra? Are you coming from Tamil Nadu? Are you coming from this place? Because the persons, the train is starting from Tiruvananthapuram, is passing from 4 states. You cannot say that everybody is coming from Kerala only. So this will be a very difficult part. The whole responsibility, which I feel, is the individual. Once I'm traveling and government has put a restriction, I should get my certificate, I should get vaccinated, I should have the RT-PCR certificate of the 72 hours. Then only I think we will be in the position to save ourselves or save over the country also. It's a good concept. Now, our learned speaker, learned persons are here. I will like to have their comments also, what they feel particularly about this thing. So, madam, I request you, Sunilaji.
Thank you so much. Thank you. In fact, I was thinking that, we are talking about the concept of immunity in context of COVID-19 now. But all of us do remember that when children from India, they're going to study abroad in different universities, their childhood vaccination is also required mandatorily. Yeah. So right. That is where, and then, I was recently in a budget meeting, which the Prime Minister held with the healthcare providers, and I spoke to him in that meeting because there was an allocated time given to me. So I said that why don't we introduce a concept like Aadhaar card? We should have a smart health card which will tell about our vaccination status throughout, which will also tell about, because all of us, we suffer from quite a number of majority of non-communicable diseases and all. I think the concept of smart health card will also, I think we should suggest that, so that we carry one card, and which Dr. Agarwal mentioned that we do have a QR code. So I think that will be easier for us to manage, and whatever, can be, is being updated, that can be entered in that smart health card. So I think that will be a smart move from our side, and accordingly, when the time changes, the smart health card can also be changing according to the situation. So these are my comments. But then again, the concept of this immunity passport or immunity smart health card is very, very important, and we need to keep that in mind, because as we don't know how the pandemic is going to behave, but also we need to see gradually, we need to incorporate the other vaccines also, like flu vaccine and all, because from this platform, I also want that we have no program for elderly. So whether it is flu vaccine, pneumococcal vaccine, they should also be a part of our elderly healthcare program also. Thank you so much. Thank you.
Thank you, madam. You have given a very nice idea. As far as the Aadhaar card is concerned, we should have definitely a smart health card, because we are suffering from a lot of persons, a lot of disease also. If the smart health card is there, which will reveal what sort of disease this gentleman is having who is coming to our country, whether he's infectious or not. It's a good idea. And I think our roundtable, this conference roundtable group should give this idea to the government also. We have got with us Dr. Ashok Gupta. We'd like to have your comment.
Dr. Rai, I would suggest the government to incorporate vaccination status in the present Aadhaar card, because getting past the new health card, Aadhaar card went through the Supreme Court validity and so much things. It will take 10 years for them to have another card. So something can be, Sunila can find out, is there a way how to add the vaccination status in your Aadhaar card?
That's also a good idea. That can be added easily also.
Yeah, it can be. It can be that we
It can be.
Thank you, Dr. Rai, and thank you, Dr. KK. It's a wonderful idea to have a vaccination passport, like Dr. Rai has mentioned about the yellow fever. And whenever we travel, there is a separate certificate of yellow fever, which over a period of time, I think the COVID vaccination certificate also is going to be a order of the day. So anybody who is traveling overseas or even within the country must have a certificate of vaccination or immunity, which Dr. KK has very well revealed, a certificate from GP. Only my concern is whether a certificate from any GP or a recognized institution which is doing COVID, that has to be held as a valid certificate, because other thing can also probably play into account if we say any general practitioner or any doctor can issue a certificate of immunity. That can raise questions of the integrity also. Second point about the smart health card. Dr. Rai, if you remember, this is a very novel concept which I have shared with you about 4 or 5 years back. And this something is the order of the need of the day, because all our healthcare patients and healthcare workers are not having a comprehensive data. It could be a smart chip based data card, primarily focused on the health issues of the person and a record keeping of the doctors and insurance company. If we can move this with the PMO and if we can move this with the health ministry, this will be a wonderful idea to have a smart health card for taking care of all the issues related to health. And I think, Dr. KK, we should take an initiative of doing this, even if it takes 10 years, but we are laying foundation for our next generation, coming generation, to have a better healthcare system than what we have struggled in last 50 years time. Thank you, Dr. KK and Rai.
Dr. Gupta, just for your information, as far as you are telling that a certificate from a GP, I think it should not be encouraged. Rather, we should have an authority, as yellow fever is being given only in Delhi by the corporation office, corporation health office, and by the RML hospital only. Other GPs cannot give this sort of certificate, and it should not be made free also. I mean, exact.
Your audio, Dr. Rai, your audio is not clear.
Your audio has gone, Dr. Rai.
Oh.
Now, yeah, it's okay.
Hello?
Yes.
Yeah.
Am I audible?
Yeah,
Yes.
yeah.
This connectivity is very bad. Yeah, that's the problem. I'm sorry. So I was just mentioning this thing. This certificate of this vaccination should be from the government authorities, as yellow fever is being given by the corporation, by the municipal corporation health office, and by RML hospital only. No other doctor or hospital is giving this yellow fever certificate.
No, I don't doubt the integrity of a general practitioner. My only concern is all the even private hospitals are being allowed as a vaccination center. So any which is a recognized vaccination center or a physician affiliated to that and treating the COVID, I mean, their certificate also should be considered as a immunity, rather than questioning the, I mean, just off the record, there could be many incidents even getting the negative positive report being issued by doctors.
Yeah. Dr. Gupta, you are absolutely right. As the government and ICMR has recognized the laboratories whose certificate is valid while traveling, such methods can be adopted. That's not a problem.
So I want to add that there is also a proof of treatment that you have recovered, which is internationally accepted. And when it comes to proof of treatment, anybody who has treated you will give a certificate. You cannot have a certificate, treatment has been given by somebody and proof of treatment is given by somebody else. So whoever is authorized to treat a COVID-19 patient, he or she will be required to give the proof of treatment for that. And for vaccination, another thing, government is giving you a certificate. I got a certificate of vaccination proof from the government. And in investigations, you can have a lab's investigations report, which you can show it to one. But when it comes to a proof of treatment, it has to be by the person who has treated you. It cannot be a third party.
Very right. And I request Dr. Jai Kishan about your comments regarding this.
Yes, sir. Respect Agarwal, sir, and all members. It's very important that we should have an immunity passport, because even yesterday, one of my colleagues who is working in UAE, he had taken that Chinese vaccine given by UAE government. After that, he got COVID and he recovered 2 weeks back. But he has to have a RT-PCR test done before 3 days of traveling from UAE to Kerala. And on reaching Kerala, again at the airport, a COVID test, RT-PCR test was conducted. For that, they have to wait for 7 hours in the airport. And after that, now they are sitting quarantined in a hotel for 7 days. And again, they have to undergo an RT-PCR test to release quarantine. Already, they have taken the vaccine and they have recovered from COVID also. So the thing is that we should have a passport. Otherwise, the difficulties for such travelers, all persons engaging in various types of businesses, and even for medical persons, even litigations can come like that. I think already COVID app is giving vaccination certificate for those who are vaccinated. That can be extended, modified, and if you upload the details of COVID recovery or the antibody test results or anything like that, the same COVID app can give a COVID passport or COVID immunity passport, so that this will be a universal phenomenon in India. That suggestion we can give, I think. Thank you, sir.
With the permission of the chair, what I will do is, I will today make a copy of a certificate, which I will circulate to all of you for suggestions. We can come back with a draft formulation of a certificate, which people can carry with them. And if some state government does not clear that certificate, then the government should provide them a free accommodation and everything, because certificate has to be certified by somebody. So I will make that certificate, send it to all the organizations to approve. And then this can become something like an SOP. Because as on today, if you are not carrying a treatment proof, then you have a difficulty. So that's what I think I should make as a treatment proof, or that you are non-infectious certificate, that you are not at risk to other certificate.
And I think, Dr. KK, now there are issues of different states having their own regulations and quarantine parameters. Unless we make a uniform regulations for all the states.
No. So the uniform regulation, they cannot take away the medical certificate that you are not infectious.
Yes.
No state can say that you are not infectious and we will make a rule for you. The rule is only for 7 days or 14 days or 21 days.
Yes.
But that medical certificate that you are not infectious cannot be challenged by any state.
Yes.
No, it's a very good idea, KK. It's a very good idea, no doubt.
Yes, thank you.
We have with Dr. Upasana ji, your comment about this one.
Sir, today's discussion is actually good for everyone, at least those who are not aware, and I am very happy with this comment that our Aadhaar card should be attached with this vaccination thing. So It will be very easy to know that who is vaccinated and who is not. So I am really happy. Thank you, sir, for giving me opportunity.
Thank you, Upasana ji. Mr. Bijon Mishra ji has raised the hand. Your comments are very valuable, and because you are from the consumer also, you are concerned for everybody. So we want your comment also, sir.
Thank you very much, Dr. Rai. I have been raising my hand for a long time. So
I'm sorry, sir.
No, that's fine. No, you may not be able to see, so I sent message to Dr. Kalra and Dr. Agarwal to tell you. Okay, you see, my contention is whatever we agree has to be patient friendly, which means, please, for heaven's sake, don't make the patient or the citizens run from pillar to post to get these kind of certificates, blah, blah, blah. Today, we have digital accessibility. Simple. All what we agree today, if I carry in a digitized manner on my smartphone, that should be made eligible for me to enter, number one. So, like Arigyo Setu, I remember traveling, I went to Uttar Pradesh, my Arigyo Setu was enough to make me enter. My contention is, please do not harass the citizen. Please, they are already overburdened. They are already harassed. and you are dividing the country into many countries. There should be uniform kind of a regulation around the country. Why Delhi will have different, Maharashtra will have different, Kerala will have different, harmonize it. Make it such that all the states accept it. There is no exception. And what I also liked was what Ayata has mentioned. For all over the world, there would be an enable factor that passengers can travel, their data will be at one place, they can go to any country, that country which has regulations can access that data and make the person enter. So there should be harmonization. Again and again, I am requesting, please, for heaven's sake, do not make this a tool for corruption. Do not make it a tool for harassment. Because the moment you make him run from pillar to post to make governance easy, people will palm money to make it easier. And why should we allow that to happen when we can bring in accountability in the process because of technology? Government is already investing huge sum of money in bringing in digitized version of health card. Now, how we are discussing every day within the government that this expenditure which will be made by the government on digitization of the health card, why can't all this come into that conversation at the same place, at the same manner, so that it is cost effective? Number one. Number two, my only concern is who is going to be the owner of these kind of documentation? Who is going to take the onus that it is not traded and misused? As a citizen, as a patient, I am really concerned about the custodian of my data. And we are constantly discussing with the government on this issue that please make sure the data is not punctured, the data is not traded, data is not misused, and data is not used for commercial purposes. So my contention is very simple. Number one, the process should be extremely citizen friendly. Number one. Number two, like what Dr. Agarwal also mentioned, if the state has goofed up and the state has not risen to the occasion, then the state should be made responsible to take care of all the expenditures of the patient or the citizen who is entering that state. And they cannot blame the customer or the citizen to say that, ignorance is not bliss. So my contention is the states have to take the onus, and we have to bring all the states under same platform, not different platforms. I like the idea of Dr. Agarwal, that what he mentioned. Let's decide on a format, let's decide on the documents, let's decide on the process and digitize it, so that government takes the onus to digitize it and make it accessible, whether it is Aadhaar, whether it is Arogya Setu, whether it is whatever platform which the government will take custodian, will become the owner. I am happy with that. Not any commercial entity. I do not want that any commercial entity to come into this business. This has to be non-commercial. So this is my short point which I wanted to make. I hope the experts on this round table, endorse what I am saying or do not endorse and convince me why I am wrong. Thank you very much.
Thank you, Bijonji. I want to add one thing. Nowhere we are recommending for the government to make it mandatory. We are only saying that it is in the interest of a person to carry a certificate in his or her pocket that A, he has been fully vaccinated or not, B, he has recovered from corona or not, and if he has not, then he carried a certificate of COVID-19 negative test if there is a requirement of traveling to that particular state. So what we are suggesting is, if you have recovered from corona, take a certificate from your treating doctor and keep it in your pocket. If you have been vaccinated, the government vaccination, what they have given it to you, make a small copy and keep it in your pocket. And if you have been treated, recovered, keep a copy with you. That's what we are saying. There is no corruption involved here. There is no commercialization involved here. If you have been treated, you need to have a copy of the treatment that you have been certified, treated. That's what we are recommending. Because if you are traveling from one place to another, sometimes your flight may be diverted. You may have to get down to that particular place. So these types of certificates carrying with you may help you in case you end up into, suppose you are entering a hotel, you are entering a restaurant, and he says, I need a proof. And if you carry a proof, it's for your own protection. It is voluntary. It is an advisory to carry a proof with you. That's it. Over to Dr. Rai.
May I come in, Dr.
Dr.
Rai?
Rai, I wanted to respond.
Madam Balbir
Yeah.
wants to.
Dr. Rai, I wanted to respond to Dr. Agarwal.
Please, please.
Thank you. You see, my only short point is, please make the citizen comfortable in terms of whatever he needs to carry. Bring a clarity in the matter. My point is, if I've gone to the hospital, got myself treated, I have a digitized history of me getting treated in that hospital. I'm carrying it on my smartphone. I'm carrying it on my smartphone. Do I still need to carry a hard copy? No, my contention is that I already have the data stored in my smartphone. My only request is that do not make the citizen again go back to the hospital to collect a hard copy, and then he spends whole day to get that hard copy. No, I please communicate to the citizens in such a manner that what all is eligible and make that uniform and harmonized in the country, so that even if the aircraft gets diverted or the train gets stopped in midway or the bus gets stopped somewhere, he is not harassed by that particular state at that border, because he is not carrying something which is uniform and uniformly accepted, so that they carry all those documents which are harmonized in the country, not state-wise. This is only my suggestion, my small point which I make.
Agreed, Bijanji.
May I come in?
We are putting an advisory and not a mandatory. Advisory is आपके पास में कोई proof रहना चाहिए अगर आपको कोई पूछे तो, चाहे वो documentation digital हो, चाहे non digital हो, but it is always advisable to carry a proof. For example, आपको वैक्सीन लग गया है, उसकी फोटोकॉपी आप उसका एक पिक्चर लेके अपने कंप्यूटर में अपने फोन पे रख लो एज ए प्रूफ कि मेरे को वैक्सीन लग गया है. अदरवाइज वो कहेंगे ठीक है हम आपके डाटा में देखेंगे, उसमें घंटा आपका बेकार हो जाएगा. सो व्हाटएवर इज अवेलेबल, चाहे वो डिजिटल हो चाहे नॉन डिजिटल हो, आपके पास में होना चाहिए. मैडम बलबीर वर्मा.
You are absolutely right.
I have 2-3 points about our discussion today. One is that I feel instead of making one more form, another vaccination certificate form, this should be enough. The proof of vaccination, the certificate given, which is digitized at the time of vaccination. As Dr. Agarwal just said, a copy of that can be carried while traveling. So the government, from the government side itself, this should be, communicated widely, that whenever citizens are traveling, whether from one state to the other, they should carry with them the proof of vaccination which they got at the time of vaccination, or the whatever the doctor treating them had given them, showing that they had recovered. I think just simple things should be enough instead of having a new draft and a new immunity passport thing. Now, whereas international travel is concerned, I think that is a little premature. Let us wait for a couple of weeks, because the German Chancellor announced yesterday that vaccination passports are likely to be available by June, and it is all going to be digital. Similarly, the International Air Travel Association has also announced. So just let us wait for a week or two to see what kind of format they come up with, so that we can make a format that would be only for international travelers. We don't even have to make a format, because everyone traveling will have to accept whatever format they are accepting. So this is one thing. Now, another thing about the smart card, the digitization of health card, as we know, is already going on. It was announced in the budget also, I think last year or year before last. I support Bejan Misra's contention about the privacy aspect, because I feel the greatest beneficiary of the data of these smart health cards will be the insurance companies. If you have your entire system of what you have, whatever you have suffered over your lifetime, there. It will be the smart, the insurance companies using it to, deny you your claims. And I'm sure this data will be accessible to everyone because we don't have any, good enough data privacy laws as yet. So I don't think from the roundtable, from this forum, we should be recommending anything about the smart health card at present. So, and also what Dr. K. Agrawal, 1 second, but just my last point, I'll take 1 minute. What you had said that even trucks and other means of transport entering Delhi should be undergo these tests. I think the trucks will not be practicable because we see what happened at the European and British border when they had introduced these tests. Trucks were stranded there for days while these tests were going on. So I think that is the reason probably why Delhi government has not mentioned trucks. Thank you.
So I want to add 2 things. I have discussed this topic because Delhi has required that if you are traveling to Delhi from Maharashtra, Kerala, Chhattisgarh, Madhya Pradesh, and Punjab, you carry a negative COVID-19 report. My point of discussion was when I showed you the slide internationally, it is not negative COVID report. It is also a documentation of recovery from COVID-19. What I am trying to say is that if you are not carrying a negative COVID-19 test report, if you are carrying a documentation of recovery from COVID-19, for that necessary, you don't require a hospitalization for that. If your GP has given you a documentation of recovery from COVID-19, that should be taken as like a negative COVID-19 test result and make you enter into Delhi. That's what the whole contention is that if you are going to ask every citizen to get a COVID-19 test done, when he does not require, he has already recovered. After recovery, he is asymptomatic. Why do I require a COVID-19 test every 3 days if I am traveling from one place to another place to another place, if already I have a documentation of recovery? And documentation of recovery means I have a certificate with me that I have suffered from COVID on such and such date and I have recovered. That should be as valid as a negative COVID-19 test. That's the subject. That was the discussion today for that.
You have rightly told this thing, and I think now from the roundtable expert committee, you should send this document to the Chief Minister of Delhi also, because they should also agree the certificate carrying that they have suffered and they have got the immunity, so that they don't and they have the certificate of treatment, so they don't require any RT PCR test should be negative only. It's a good idea. I think you should inform to the authorities that also.
Shashank has joined. I will like to ask his opinion also before finalize.
Yes, Shashank.
So Shashank, what the question we are discussing is that yesterday we have read it. I have not seen the circular. The media report says that if you are traveling from Bombay to Delhi, you will carry a COVID-19 negative test report. Okay, done in the last 3 days. So we are asking those people who have carrying with them a document of recovery from COVID-19 in the last 3 months. That means they have a certificate from a medical doctor that I certify XYZ has suffered from COVID and I treated him and he has now recovered. Should that be valid, or they will in addition need a COVID virus antigen test? Because if they are traveling from one state to another, for every 3rd day, they will have to do then a RT-PCR test. That's what we are talking about. Or if they have been vaccinated, so they carry to either they have been vaccinated or they have recovered and they have not crossed the 3 months, which is the definition of not doing their RT-PCR test. Because CDC very clearly says that if you have recovered from the illness, you are asymptomatic. And if you are going for any hospitalization, you did not do a RT-PCR test. So I want those people to get exempted from RT-PCR test when they enter from one state to another, if they have a proof of recovery from a GP.
So, sir, you are very right. I would like to just put on record 5 things. Number 1, if a person has recovered from COVID in the last 3 months and his first RT-PCR test was positive and then it turned negative, he should be exempted. Second thing is if person has received 2 vaccines and more than 2 weeks have passed and he has a documented proof of IgG, which is equivalent to a neutralizing antibody, he should be exempted. Number 3, if he is having 2 vaccines independent of COVID and 15 days after the second vaccine, which will now happen because it has not happened for everybody, because vaccination today is only the 6th week which is happening. But after 8 weeks plus 2, which is 10 weeks, and they have a IgG certificate after 10 weeks, that also should be exempt. The last thing is that if somebody had suffered from COVID more than 3 months, but less than 6 months, okay, if he has one COVID negative report, okay, then it should be valid interstate for a week. Because what is happening, sir, is a big problem. Now, Bombay actually started this rule almost Maharashtra 3 months back, that any person coming from Delhi, Rajasthan, Goa and Gujarat needed a COVID negative certificate. And what people started doing is they used to fly from Delhi to Hyderabad, Hyderabad to Mumbai, or they used to fly to Bangalore, Goa to Bangalore, Bangalore to Mumbai. So ultimately, it didn't serve any purpose. And it really became like a pain. So we realized it, and we also suggested to our administration that please don't do these draconian measures, because they only inconvenience the passengers and our public health emergency part is not taken care of. So I agree with you that, see, now it has become, there is actually a diagram which Dr. Agarwal, I don't know whether you have seen that, which state, how they move. I'll send you that diagram. It's a nice slide, which I'm sending it to you on WhatsApp in another 30 seconds. If you can portray it, which state has what measure. I think I totally agree with you that all governments, we should write, even if you write a letter, I will send it to our chief minister, that do not do this. If people have suffered from COVID, they have documented proof or a certificate of a GP in the last 3 months, please exempt them from COVID test. Or if they have a vaccine card, 2 doses with an IgG positive, exempt them. So 2 exemptions, keep it simple for them. And I think we should appeal to government of India also, because eventually now for travel across the world, they are going to have these immunity certificates or vaccination certificate. They are not going to call them immunity passports, because that term somehow or the other has not been liked by people at large. The microbiologists are allergic to that term. I don't know for what, but they are a little allergic to that term. But you call it whatever it is, vaccination certificate or whatever it is. And one more thing, the self-declaration we have started in Maharashtra, that the person involved has to give a self-declaration that independent of his immunity and vaccination status, he will adhere to COVID appropriate behavior. So, we have this in Marathi, we call it Me Jawabdar. Me Jawabdar means I am responsible. So he has to give an undertaking that I am responsible for myself. See, we are a citizen of India, Dr. Agarwal, you know law better than us, all of us. So, if you take that Me Jawabdar responsibility, by and large, this should not be there, because, and other extra thing we have told also many people is, when traveling, when you cannot maintain distancing, double mask. Now, globally, this is accepted, that if there is no contraindication and if there is you cannot do distancing, because this I had to particularly push for the trains, because in Mumbai, crowded locals, from 20 lakhs, the population went to 35 lakhs. And obviously the numbers started going up. So the solution we said is, when you're traveling in a crowded compartment of a train, local train in Mumbai, it is impossible to maintain distance of 6 feet. We said double masking is the solution, and sanitization is the solution. And I think that to some extent has worked. Our numbers are high, but our TPR is 4.5%. So even if we have 1,000 plus cases, yesterday we tested 22,000 and our TPR is 4.5, which was 6% last week. So Bombay is now settling down. So these are my some suggestions, sir. But I agree with you.
So do you think that in Mumbai, Maharashtra, what we are seeing, I normally say whenever there is a spurt of cases, there will be a local mutation. Local means state specific, because we do get mutations occurring every time. And there are 2 types of mutations. One are substitution mutations, second are deletion mutations. Now, deletion mutation is basically in either 69, 70, 144 in UK, or there are 244 to 244 mutation in South African mutation. Now, these are the mutations there, because once there is a deletion, it cannot autocorrect. Now, we are seeing 484, 440 mutations, which have been talked about in Maharashtra. So similarly, we have a single mutation coming in California, some coming in New York. These are local spots with a local mutation. So do you think that this, at this moment, the second so-called second wave in whichever state we have or in India is going to be short-lived, going to behave like a Rajesh Khanna? It will go and come back within a short period, will not be higher than the first wave, will not be broader than the first wave. This will be like a spurt and not a full wave. Shashank.
So let me clarify on the mutations. The first thing is that in 5 districts of Marathwada and 5 districts of Vidarbha, a red flagging was done almost a month back because there were Gram Panchayat elections and we were started seeing higher number of cases. There is only one outlier which is there in the cluster, which is the Amravati cluster. Amravati cluster had a freak TPR of 53%, which went down to 30%. Now that is very difficult even if the denominator is small. And that 4 samples from them at the sequencer at the BJ Medical College Microbiology Lab found 384Q and 384K. First, they were not sure whether it's K or Q. And they have given those samples to NIV. And that probably is like the British strain, which is highly transmissible. And that could be explained for that Amravati part. Amravati has been micro-contained and locked out for a week. And the lockdown will continue for 1 more week. Now, that was one. Second is there is an area in Shahada called in Nandurbar. It's in Marathwada. There a lot of international travelers come. And they come from different parts of the world. That could have potentially been the public health source from where the Marathwada and Vidarbha region intermingled and probably another mutation came up. So that N440 is basically a Telangana mutation or Hyderabad mutation. And that probably spread. But there is no clinical impact or transmissibility impact. Mumbai doesn't have, we have tested almost 600 samples. No deviation of mutation or deletion has been seen. Neither has any deletion been seen in any of those sequenced from Maharashtra. So in Maharashtra, the only cluster which is potentially likely to cause a challenge where a mutation can be attributed is the Amravati cluster and the Amravati region. Except for Amravati region and Amravati cluster, everything else appears to be lack of COVID inappropriate behavior. And the biggest fault which lied was the community testing had disappeared. People had stopped doing community testing at all. Only when you go to hospital, say Dr. Gupta wants to do a surgery or I want to admit a patient for diabetic foot, I was doing COVID. But otherwise, if somebody had cough and cold, nobody was doing COVID. That had stopped. And that is why the community testing rates had dropped down to even, in Mumbai city, they were down less than 2,000. And now we are back to 20,000. So that is why that Mumbai has a thick tail. That thick tail of 300 became 500, has become 1,000. TPR was 7%, came down to 4.5%. So actually, if you see Mumbai numbers are high, but TPR is low. So, I'm not so sure that there is a second surge at all. Only if that Amravati cluster spreads across the regions, which now probably appears to be contained, I don't think there'll be a second surge. So I personally feel, if you ask me, we are into a containment mode. If we double mask and make people responsible, I think second surge will be avoided and we'll go into the vaccine mode. The only challenge is Covishield can duck this Amravati strain mutation, because that 384 you may not be having ability to mount an antibody. So that is my only worry, because all of us are Covishieldized. And I wish I had a choice to take Covaxin. So maybe Covaxin would have been better, but that's my personal thinking. Now I have deferred my second shot because my neutralizing antibody is 95% and my IgG level is 4 times or 5 times higher. But that is where I stand. And I'll be happy to answer questions on Mumbai, because Mumbai has become a hotspot and Maharashtra has become a hotspot and we are all in hot seat. In fact, that's the reason last week I couldn't attend your meeting. And even today I was in a meeting. I just came out of that meeting because I wanted to speak to all of you.
So Ashokji, just 1 minute. Ashokji, 1 minute.
I just want to compliment Dr. Joshi about this double mask. It's a wonderful idea. As a surgeon, we have been using double mask and double glove in all our surgeries, and it really gives a full protection. But only thing, when we are asking for double mask, there is a layer of mask which is permeable and which is non-permeable. The white is permeable and green is non-permeable. So that when we put a double mask, it should be a combination of 2 sides. That will give an additional protection rather than just putting a mask on top of it. I think
Dr. Gupta, I would appeal to you that make a small video and we'll make it viral across Maharashtra. I'm not seriously across India. In fact, with Dr. Agarwal with us, see, because wo aap bataiye kaise karna hai, so it will become viral. And in fact, I'll ask BBC to contact you and all other medias, because you make a small clip, maybe it's just 30 seconds or 1 minute, how to do the double masking and this permeability non-permeability. Dr. Agarwal.
So 3 things I want to talk about. One is, say India they have reduced the charges of RT-PCR. The polygene testing has finished. Initially, they were doing multiple genes. At least 3 genes they were doing. I know of this Fisher, Thermo Fisher. They were doing N gene, S gene, and ORF1AB. And then they started getting S gene target failure to pick up the UK. But now everybody is doing only E gene. And if it is positive, then only they do a RDRP. So we are going to miss the mutations if the government does not allow a polygene test at a higher cost. Because if the cost is uniform, whether you do 1 gene, 2 gene, or 3 gene, 3 gene tests will not be available, and you will be missing cases in the private sector, specifically if they are immunocompromised. Second is Covaxin produces 2 types of antibodies, N and S, because it is a full virus. It is not only a spike virus. Therefore, it will give you both N and S antibodies. And we know from pediatric multisystem inflammatory disease, those children who develop S antibodies does not develop N antibodies. And these are the people who develop a secondary inflammatory response. From that point of view, the Covaxin is better than Covishield, or maybe one Covishield and one Covaxin will produce a better result. The time will tell us that second. Third is, I just want to say, when it comes to mask is 3 layered. The outer layer is water repellent, inner layer is water absorbent, middle layer is a filter. And when they are talking about a mask, means 3-layered mask plus extra. Double masking means either you use a surgical mask with a cotton mask, or you use 2 surgical masks, or you use because double masking they are basically doing is so that it becomes tight. Because when you use this, it is not tight. It is not tight. So when you have one more over this becomes tight. So the purpose of double masking is to make it is airtight. That's the whole purpose. Yes, Dr. Rai.
So our thing was in Mumbai, everybody was using a cloth mask in the trains. So when you have a double cover,
cloth mask has to be, cloth mask is 17 to 18% effective in terms of transmissibility.
Correct. So that myth, to break that myth, at least by another non-cloth mask, was an indirect message you are trying to give to the crowd because of the crowded clustering and because of the surge of cases. So, you know, what people have started now doing is they are having one cloth mask which works like a covering, and then have another, you know, simple 3-ply mask, which is fine with us. Yes. So that was the purpose and the intent behind it. Sorry.
Actually, only surgical masks are 3-ply mask. Most of the other paper masks are 2-ply masks, which I have checked also. So, and also the porosity of these ordinary masks is not as strong as the surgical mask. So I think we need to define the quality of mask and the layer of the 2-layer, 3-ply, 2-ply mask, etc. And this will be a better in the interest of the both state and the patient also to choose which mask they should wear, and whether a 1 cloth mask and 1 paper mask will give a additional protection rather than just 2 paper masks or a 2 cloth mask, etc. So I think it's a good idea to make a video and then distribute it across the country.
Dr. Rai,
I think advisory should be sent to the government also. They should discourage this. Nowadays, a designer mask are in the market, which is creating a lot of problem. We should not encourage the designer mask. I mean, now people have started using the whatever ladies' suits are wearing. They are asking for the same type. Because we are concerned for the health of the country, we should stress only on this part. The mask should be protecting yourself and protecting others also. No designer mask. I think Sanchita ji is remaining. We want your comment, Sanchita ji.
So even 2 surgical masks together is also
sufficient.
Yes, it's sufficient. 2 surgical masks
is sufficient, no doubt.
Shashank, your audio is not.
No, Sanchita ji.
Sir, we are talking about an immunity certificate, but if it is not mandatory or recognized by the government, will not the government guidelines supersede, or will not that prevail over it?
Sanchita, it is for your own purpose. You carry a certificate, proof of certificate of either you have recovered or vaccinated with you for your own personal protection, not from, as on today, mandatory we are not talking about. If you carry as proof that you have been vaccinated, it is for your own good.
Yes, sir.
I'll request Dr. Rai to sum up and close the meeting.
I thank you very much, all the participants who have given their valuable suggestions also. And one query was raised by Bijon Mishraji. I think even the government has now recognized any documents you are having in your smartphone, they are considered as valid one. So nobody should carry the hard copies, and rather government should publicize also. Anybody having the certificate in the smartphone will be accepted by everyone. Thank you very much, sir. I think it's a nice idea, and the expert opinion should go to the different governments also. They should adhere to that. Then only we will be in the position to curtail and curtail this infection pandemic also. Thank you very much, sir. Over to KK.
I think already time is up. We need to close the meeting. I think in spite of this certificate, vaccination certificate, one should not forget the use of all precautions. Even you are having certificate in your pocket, we should not forget all the precautions we have learned during COVID. They should continue, whatever, regardless of the vaccination status, all precautions should be continued. I thanks Dr. KK Agarwal, Dr. Rai to chair the session today, and all the expert groups who attended the meeting today. Thank you very much, and see you again next week, same time with some new topic. Thank you.
Thank you very much.